my name is Lisa McNamee. I'm the educator for behavioral health, and I'll be demonstrating some escape moves today.
Hello, my name is Amanda Melchiori. I am the clinical nurse educator for the ICCU and 6-sheet, 6-catheter. I'll be demonstrating with Lisa.
So Amanda will be playing the role of the aggressive patient or visitor. I'll be playing the role of the staff member. And this is just a couple of reminders. These moves are not from any specific program. These are moves that anyone can get from the internet, and they are meant for you to get away. We are not here trying to assault or hurt patients or visitors. The goal is for you to get free, run, yell, ask, get help. Remember that if you do need hands-on for someone who's aggressive, you call 829-5050 and call a Dr. Shoreman, and security is trained to do hands-on. So the first thing I want to talk about is your stance as you're talking and trying to verbally de-escalate somebody. First of all, you're going to be mindful of your distance. You want to be kicking, punching distance away. You don't want to be too close. You also want to be mindful of the exit. You want to be able to get out the door without them blocking you. They should never be in front of the exit, so always be mindful of that. Lastly, if you do have to get out of the area, you want to back out of the room. You do not want to ever turn your back because you can get punched in the back of the head or assaulted from behind. So always keep your eye on the person. Another point is once we remove our masks and COVID is done, to keep a neutral look on your face. You don't want to smile. Some people smile when they get nervous. Some people frown. You just want to have a neutral look. Nothing judgmental. Your hands should be out where the person can see you. Never behind your back, never in your pockets, never clenched in a fist, never pointing in their face, and never touch somebody, even if you feel like you're trying to comfort them. That could just trigger aggression. So the other thing is you want to be in what we call like a neutral stance, sideways. You don't want to be face first. You could get pushed over. This is better balance, and if I need to get out of the way, I'll be able to do that. So the first move we're going to demonstrate is the same side wrist grab. The goal of this is to break the grasp at the weakest point, which is between the finger and the fingers and the thumb. So you're going to make a fist. You're going to reach in, you're going to snap back to your chest. Okay, one more time. You want to be careful not to go up too high and hit yourself in the head. Reach in, elbow down, snap it to your chest, and get away from the situation. Then we have two hands on one wrist grab. Now this time it's the same move, but you're reaching into the middle. So making a fist, and it's the same thing. You're breaking the grasp between the thumb and the rest of the fingers. Reach in, grasp the hand, snap it to your chest, and back up out of the room. One more time. Make a fist, reach in, snap it to your chest, and get out of the area. Then we have the opposite hand wrist grab. Now this move is the same release is not going to work because now you're in a different position. So what you want to do is there's two options. One is what we call answer the phone. Pretend that you're answering a phone, and that will break the grasp. Hello, answer the phone. Need some help here. And other move would be to pour the coffee. So just pull like that, and it breaks the grasp. One more time. As if you're pouring a pot of coffee. Okay. Next, we're going to talk about what to do if someone pulls your hair, either from the front, one-handed or two-handed, or from the back. If they grab a ponytail, grab braids, grab any pieces of hair, especially if they get it all tangled into long hair. So what you don't want to do is pull away, otherwise you're going to have a big bald spot. So you're protecting the patient's wrist by putting your hands in there, and you're pushing your hand into your head, so that even if they are starting to move around, you're going with them, help, 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 yeah, help me. And then your peers are going to have to come and untangle their fingers from your hair. Okay, and that would be the same if someone grabbed you with two hands, you'd hold on, or if they grab you from behind. Hold on, yell for help until someone comes and untangles that hair and makes sure you can get away. Next thing we want to talk about is blocking a punch. So, again, you're in your non-defensive posture, hands are up. Now, there is an inside block, and then there's the outside block, just pushing them away. So, you never know which, Amanda's kindly gonna tell me, or show me which hand she's gonna hit me with, so I'll be a little more prepared. But if you see it coming, you can get away. But if you're kind of in a spot where you have to block, if it's a straight punch, I'm gonna do the block from outside. If it's more like a roundhouse punch, I'm gonna block from the inside. And again, trying not to injure the patient by directly putting pressure on wrist, elbow, or shoulder would be good. And if they're coming at you with the other hand, so if it's a straight punch, you push out of the way. And if it's roundhouse, you're gonna block like that. And then the last move I want to tell you about how to get out of is a front choke. So again, first thing you want to do is be mindful of your airway. You want to put your chin down to protect your airway. You got to put your hands inside, break the hold, and escape. One more time as a demonstration. Chin down, reach in, break the hold, and back up out of the way. All right, I hope that helps. I certainly encourage you to practice this with your peers and your loved ones at home so you can get good at this. Like any skill, it just takes practice. And thank you for your attention.
Thank you.